Now we start an ultrasound examination. But, Christine, is there any precautions we must know?
Well, since we want to obtain clear images, we have to ask the patient not to eat before the examination. The stomach should be empty.
That's right. Then if the patient did eat, what would happen to the images? These images show the pancreas of a patient examined before and after a meal. The image obtained after a meal is unclear. This is because ultrasound is blocked by foods or intestinal gases, and therefore cannot reach the target organ. The gallbladder discharges bile after a meal, then it shrinks. Therefore, the gallbladder wall appears thick and three-layered. This may result in an incorrect finding of cholecystitis. To avoid this, tell the patient not to eat after 9 p.m. on the day before the examination. The examination should be performed in the morning. If the patient is severely constipated, we may administer a laxative on the previous day. When the ultrasound examination is performed in conjunction with gastric fluoroscopy or endoscopy, ultrasonography must be performed first. This is important because the barium taken for examinations of the digestive tract coats the gastric and intestinal walls, making ultrasonography impossible. If it is necessary to carry out an ultrasound examination in the afternoon, the patient can have a light breakfast, but must refrain from eating or drinking for at least 6 hours before the examination. Now, let's start the examination, but before that, we must ask the patient some questions. First of all, confirm that the patient is in fasting condition. Check if the patient experiences any subjective symptoms, and also if the patient has previously undergone an examination or a surgical operation. What should we do to ensure a successful examination? Well, we must follow given procedures and examine the entire region of interest. We must not concentrate on the first lesion we encounter, otherwise we may miss a second or a third lesion. By scanning carefully, we can discover hidden lesions.